was driving towards my place of work, and a bin lorry pulled across the front of me, in between two wagons, so I didn't see it coming. And basically, I've hit that wagon in my car head on.
How's your pain doing at the moment?
It's in my back. It's
In your back?
Yeah. And obviously I'm frozen.
So if someone's been hit by a car at reasonable speed, you've got to assume there's going to be quite a lot of damage happening.
I just finished work and I'm on my way home. And as I was driving on country lanes, a white car hit me and then it span round, went on its roof and then it ended up back on wheels.
Okay, she's done a full flip.
Yeah.
This is Mavis. She was crossing the road and a car struck her to, we think, her right-hand side. She's landed 3 metres from the car, face first. We're on the floor about 40 minutes before we got there. She's got a large laceration just above her left eyebrow, the graze to the top, and then I don't know if she's got a fractured dislocated foot. Quite a lot of blood, to be fair, clotting everywhere.
We don't know how fast the car was going.
The police said about 20 to 25 mile per hour.
She's being thrown up.
So she was on this side of the pavement and she's landed against the other. So she's gone the full width of the road. Husband had been shopping with her. He went to put the shopping away and then thought, oh, she's been a while. And then went and found the road.
Okay. My concern for Mavis immediately is she could be bleeding internally, could be multiple broken bones, problems if she's got lung injuries, okay, all these things are potentially, life-threatening in someone like her.
Assisting Dr. Young is Dr. Kate Hargreaves.
We've got no obvious external hemorrhage. She's alert, orientated. Chest sounds fine. A small amount of left-sided chest wall tenderness.
Yep.
Belly's nice and soft. Moving all 4 limbs. Obviously got some laceration to her head.
Yep.
But nothing else like
Yeah, can I monitor on
immediately.
this?
We're just getting monitoring on it now, yeah.
Okay, good.
With potential life-threatening injuries, Mavis needs to be assessed straight away.
And if you just bring your teeth together for me, do they feel normal together? They do. But the eyes were equally reactive when I checked initially.
Just press on the upper lip.
It's an anxious time for husband Kenneth. While the team in Resus is trying to uncover the extent of Mavis's internal injuries, Resus, 76-year-old Mavis is in severe pain after being hit by a car.
Are you warmer now, Mavis?
I can't find her for all these blankets.
You're still feeling cold?
Still a bit, yeah.
Have a finger there.
I'm not moving it.
With the risk of internal bleeding, the team needs to find out the extent of her injuries quickly.
What we're going to do now is we're going to take you around to have a CT scan if you need some pain relief before we go. Yeah? We have some IV paracetamol as well. We're going around and then.
Someone, as we're getting older into our 70s and 80s, even just a fall from standing can cause serious injuries, from chest injuries, head injuries. So someone who's been hit by a car at reasonable speed, you've got to assume there's going to be quite a lot of damage happening.
Are we ready to rock and roll?
Yeah, indeed, yeah. All right, we'll see you in a minute.
All husband Kenneth can now do is wait. Over in radiology, Mavis has had her CT scan and is taken back to Resus. Dr. Hargreaves monitors her condition.
How's your pain doing at the moment?
It's in my back. It's
In your back?
Yeah. And obviously I'm frozen.
Come on, can we measure to him again? If it's low, we can get the bear hugger on.
Trying his best to comfort Mavis is her husband Kenneth.
We're going to measure that temperature again and try and get you a bit warmer. Just going to loosen one of these. Keep your head nice and still for me. Yeah, we'll get a nice warming blanket on you, I think.
Right, thank you.
You're welcome.
As a result of shock and trauma, Mavis's body temperature has plunged.
You're going to wish you'd got one of these at home.
To prevent potential organ failure, nurses Lisa and Mimi warm her up with an inflatable blanket filled with hot air.
Lovely. Off you go. You're cooking. What temperature? High, low, high. Right.
now.
It feels lovely.
We have young men who come in with less than half the injuries that this young lady's got, and all they do is squawk. This lady just doesn't. She's tougher than a pair of road bulls, aren't you, maybe? Typical Barnsley lass. As hard as nails.
Mavis might be warmer, but she's not yet received the results of her CT scan. Over in Resus, 76-year-old Mavis is waiting for her CT scan results after a car ploughed into her while she was out shopping.
On that scan you've just had, your neck's absolutely fine, all of your body's absolutely fine, there's no bleed in your brain or anything like that. They think you might have broken just the bone along the side of your face there, but I hope that that will just heal on its own. I'm going to have a chat with the specialists, but there's nothing that is untoward at all on that scan, okay? So what we're going to do is slowly, we're going to get you out of all of these blocks and things and let you sit up a little bit and see how you feel.
Whilst not life-threatening, Mavis does have multiple injuries to her head, face and hand.
Okay,
That's fine.
should we stop there for now?
Yeah.
Right, we'll want a couple of stitches, okay? It's all the way across your eyebrow, so we want to get a nice finish for you. And you need an X-ray of that thumb as well, don't you?
Yeah.
Yeah.
Have you got a tissue? From this left-hand side.
Left-hand side.
That's it.
There's some dry blood on your lip, you
I
see.
know.
Have we got any allergies, have you, maybe?
Only my husband
Only you. Oh, he seems like a good one.
is.
Well, how long have you been married?
How long have you been married then?
57 years.
57 years, that's it.
Oh, goodness me, congratulations.
20 on them's been happy.
You're a dinner lady at school?
Yeah.
You're a dinner lady.
I used to be a lady in a past life.
Did you?
I did, I'm a lollipop lady.
I'm really sorry, darling. I know it's going to be a little bit tender here.
Yeah, it is actually.
Sorry, sweetheart.
I'm not coming home till it's lovely and warm and
She's stopping in this bed, Ken.
Yeah.
You've
I
got
want-
bed
I
to
want
yourself
this
tonight, love.
A full bed instead of a third.
With treatment still needed, Mavis heads for an X-ray on her damaged thumb.
see you in a bit.
Okay. Behave.
76-year-old Mavis has had an X-ray on her badly damaged thumb and is heading back to Resus. Dr. Maz Yousafpour, a specialist in facial injuries, arrives to assess the deep lacerations on her face.
My name's Maz. I'm part of the Oral Max facial surgery team, so it's nice to meet you. So I'm going to have a little look at your face, okay?
You're getting there, aren't you?
I don't know how painful this will be.
Well, I'll try and be brave.
Remove that little dressing that's on the side of your
just
face.
remove it.
Is that okay? Are you comfortable?
As comfortable as I will be.
Let's have a little look. Yeah, so
That's sore in
that's
there now.
sore here. Okay. Up here as well.
No.
And so here, which is understandable. You've got quite a bit of swelling in that area.
Dr. Yousafpour starts to stitch Mavis's wound.
Sharp scratch. Okay, is that all right? Sharp scratch again. There we go, well done. Any pain at all?
No.
Yes.
No.
There's no injury to the eye, so that's obviously the most important thing, isn't it? There will be a scar at the end.
I think she's doing very well. She seems to be just telling them they can get on with it. She's much tougher than I am. Can't be easy. It's different parts of the body, isn't it? It's not just one specific thing. Very proud of her.
Mavis, we're all done. So what we'll do is we'll see you again in 1 week's time and we'll remove the stitches because we only want them to stay in for 7 days. And then we'll review you regarding your facial fractures as well, just making sure that everything's okay.
Right, thank you very much.
Is that all right? No problem at all. Take care.
But Mavis's urgent medical care is not yet over. Her hand is so badly injured, she needs specialist care to avoid long-lasting damage to her thumb. Still in resus is 76-year-old Mavis. At risk of losing her thumb, she's waiting for the results of her X-ray.
Are you ready? I think the thumb man cometh. He'll numb it for you.
I don't know.
I'm telling you. He'll numb it for you.
Orthopaedic surgeon Mr. Khan is the 6th specialist to treat Mavis today.
Hello, Mavis. Oh, bless you. I heard that you were injured. You got knocked down by a car. Now, what I could see on your x-rays is your joint is sitting out of socket. And there's a bit of tear on the skin. I'll give a bit of local anesthetic to make it numb, okay? And then we will just try to push it back in place. We'll look after you, okay? So just to bring your hand up, you don't have to look at it. You can just look away.
I will.
Okay. Well done.
Mr. Khan must realign the thumb as quickly as possible.
Skin in Mavis age group is quite fragile. So you just have to make sure inside pressure it doesn't lose its vitality and dies out. And if it dies out, there would be more complex treatment, and some people do end up losing their thumb. So Miss Mavis, it's gone a bit numb.
It has got a bit numb, yeah.
Brilliant, brilliant. Okay, just relax now. Okay, now are you strong enough?
I don't know.
How does it feel?
Okay, just stinging a little bit.
Yeah, yeah. Just relax now. That's gone back now.
Oh, is it good?
Yeah, look, it's gone straight. Okay?
Good, good. Magic fingers.
See, I can move the thumb now. It was like a
Oh, yeah, you can.
burner before.
Oh, yeah, that's brilliant.
But the job is not completely done yet. You just have to take it to theatre, wash it properly, and suture it. Okay? But for the time being, the pressure that was on your skin is taken off. Skin would have gone black. Save the skin around it and save the joint for the time being by pushing it back in place. So acute emergency is over. Thank you.
Do you want some tuba grip on that?
A woolen crepe bandage.
Yep.
Not coming home.
After having her thumb stitched, Mavis was admitted to the orthopaedic ward and was released home to husband Kenneth 5 days later.
Hello. Hello, sir. What's your name?
Oh,
Hi. My name's Tom. I'm one of the doctors.
oh yeah.
What's your name?
Jeff.
All right, Jeff.
These sorts of situations can be very daunting for the patient. They don't know anyone around them. They maybe don't remember everything that's happened as well sometimes. It's just trying to make them feel at ease.
You're in hospital and we're going to check you over, okay?
Yeah.
What we're going to do first is we're going to move you onto a different bed and we're going to do a bit of a top-to-toe survey, okay?
Yes.
All right.
1, 2, 3. So Jeff's been out shopping, turned out onto the main road. A car has come out of the junction. Jeff swerved to avoid it. It's a parked car. His car's gone up onto its side and slid along on the floor.
Okay. You happy to take the heads once these are
Yeah,
off?
no problem.
Then just watch out for glass. Are you happy with the neck? Yep. We're just going to keep holding on to your head for a bit longer, okay?
Yes. You're going to hear lots of commands, Jeff. Don't worry about them, okay? Okay. If you listen to me, I'm the one that you need to listen to, all right? So all the other things you don't need until the doctor starts asking the questions, then listen to him.
The next few minutes are critical. The team will need to determine if Jeff has life-changing neck or spinal injuries. Barnsley Casualty Department is at capacity.
Sorry you've been waiting so long. Oh, it's very, very busy.
The hospital wards are full, so Casualty can't transfer any patients until beds become available.
We've escalated it up to the trust managers. They're trying to get some beds.
And if we're happy to move off the board.
While Dr. Humphrey manages the bed situation, Dr. Fish is treating Jeff, whose car was flipped onto its side.
Okay, we're happy with the airway.
The team need to assess the severity of his injuries.
Don't you move, Jeff. Keep nice and still, that's it.
Just have a listen to your chest, Jeff, okay? Nice deep breath in and out. If anyone comes in on a red phone call who might be seriously unwell or have been in a serious accident, we initially want to highlight those things that you need to deal with straight away that might be potentially life-threatening injuries. Let's have a feel of your tummy, okay? Okay. Try and relax for me. Oh. All right, I'm sorry. There's obviously a very acute tender in that area. Next thing, look, roll and assess. We'll remove the collar and you're happy to take control of the neck. Yep.
Oh. Ready, steady, roll.
Thank you. Jeff, what I'm going to do now is have a press down your neck and your back, and I want you to let me know if you get any pain, okay?
Okay.
Is there any pain in your neck at all?
No.
And there's no obvious bruising or anything on the back. Okay, so on the head command to roll back.
Steady and roll back.
Has he moved his neck at all?
Yes, he's moved his neck when he were in the car.
I'm happy for us to let go of it. Okay.
Right, Jeff, I'm going to let you go, okay? No sudden movements on your head for just a while, okay? That's it.
So Jeff,
Yeah.
you've obviously been in a car crash. You've got quite a lot of pain on that side. The concern is that you can get internal injuries.
Right. Yes. Yeah.
Jeff is taken for an urgent CT scan. The worry is he may be bleeding internally.
I think I'm being lucky. Very lucky. Can't grumble.
No.
I'm all right, so that's
You're in
main
one
thing.
piece, aren't you? That's main thing for today.
Yeah. So it looks like them driving days have gone now.
You reckon?
Well, I feel comfortable that my wife doesn't, so...
No.
I mean, we need a car, really. She's an invalid.
Yeah, so you have to get about and that.
Yeah, so...
It's not as easy though, is it, when you've got to start planning other
I
people
know,
to
that's
take
trouble.
your places and that.
I don't like asking people.
I know. I know.
So, but if that's what it's got to be, that's what it's got to be.
Yeah.
So his spleen looks okay.
Dr. Fish is reviewing his CT scan.
There's no free fluid in the abdomen that we can see. There's no obvious lung contusions. Hello. How you doing?
Not so bad.
Got good news. So the scan is fine. So it's just muscle bruising. There's no breaks in your ribs or anything like that, and your tummy's fine as well. So that's good news, isn't it?
Yeah, brilliant.
So if you're really struggling with the pain, please get in touch with your GP. How are we going to get you home? We need a lift, or are your family able to come and get you?
I think my son will come and pick me up.
Yeah, fantastic. So that's all. So we'll get that taken out. I'll get the painkillers.
I'm happy with that anyway.
Yeah, me too.
I've been very happy. Thank you very much.
Sorted, no worries.
Thank you.
To have someone come in really unwell, and then after they've finished with however many hours they spend with me in A&E, you can see that they're on the mend. That itself, yeah, is very satisfying.
We're onward bound.
After being given the all clear by Dr. Fish, Jeff is picked up by his son Lee.
It's just badly bruised.
Right,
Badly bruised.
no broken ribs.
No.
Please don't do it again.
40-year-old Nicola's car was rolled over in a road traffic collision. Advanced nurse practitioner Dave brings his 9 years of experience in the profession to the case.
Nursing seems to travel in people's families. Both my parents work for the NHS, so maybe it was fate that I've ended up in this job, who knows. Hello. What's happened?
I just finished work and I'm on my way home. And as I was driving on country lanes, a white car hit me and then it span round, went on its roof and then it ended up back on wheels.
Okay, just in a full flip.
Yeah.
Okay. One of the first things that we need to look at is, are there any head injuries? Not all head injuries can be seen. Did you lose consciousness at all?
No.
Okay. What are your injuries at the minute?
My head is really hurting this side. It's killing me.
Just pop your mask down for a minute. I'm just going to get you to do a few weird things with your face. Puff your cheeks out for me and hold them there. Good. Show me your teeth. Stick your tongue out. Move it from side to side. Is that painful?
Yeah.
Now you're getting a decent amount of swelling. Follow my finger with your eyes. Any blurring or double vision?
I don't think so.
Let's have a look at the shoulder then. Right, and whereabouts is the pain?
Yeah, there.
You're quite tender over that shoulder. We'll get an x-ray. Any nausea?
No.
Okay, you might get some. I think you've had quite a bit of a concussion. What have you had pain relief-wise?
I had some cocoa develop.
It's made no difference. No, John's been a bit stronger. Yeah. We'll get you some pain relief on board. Once the adrenaline has worn off, the patient gets time to sort of process what's happened, and shock can sort of hit, and you can sometimes get overwhelmed with emotion.
Now Nicola can only wait to discover the extent of her internal injuries.
I heard that car had overturned, so I was just worried about what she were like, really. I'm glad I were here, because obviously it's a bit difficult for people not having relatives here at the minute. Fingers crossed she's going to be okay.
There's always a bit more pressure when a patient's relative is also a colleague. Not that that means that they get any different treatment, but it's always there in the back of your mind.
All right.
Yeah, I'm stiffening.
You're going to get worse. But next few days you're going to get more stiffer, I think.
Some oromorphel for your pain. Are you okay to do it?
Yeah.
Do you want me to come in there, Jonathan?
Yeah, you can do.
Yeah, thank you.
Gemma leaves to let her brother know how his wife is coping.
She's had an x-ray of her shoulder and x-ray of her jaw, and he's just going to have a look at x-ray now, and then he'll let us know what's what.
Right.
She's just getting more and more achy. She's got a bit of a bump.
Did they say something about a CT or all?
Doesn't necessarily mean she needs a CT, I don't think, but I'll let you know if they do.
Right, cheers.
See you, mate.
Nurse Dave gets Nicola's x-ray results.
When I was poking her sort of here, she was really tender. Have a look at her jaw next. She's tender and a bit of swelling over the right side.
There's always one particular worry after a car crash.
Oh, just borrow your eyeballs for 2 seconds. Get some head injury advice.
Yeah, of course.
He checks with consultant Dr. Joe Stone.
And that's where she's tender, is it? Yeah.
Just under, about here. And then she's got...
Oh. All right.
Thank you. Hello. You've had a pretty lucky escape. Yeah, good news. Nothing's broken. Everything looks in good condition.
That's good.
Nicola's very lucky to get away with just a few bruises and aching muscles. It's a very lucky outcome. Have you got some way of getting home?
Yes.
Yeah.
My sister-in-law, she's a good one.
Marvellous. You're going to pay overtime? Yeah.
Worth more than that.
Smash it.
Yeah.
All right.
Thanks, Dave.
All right, you're welcome.
I'll go get changed then and I'll come back. Is that all right?
Yeah.
All right.
All right, thank you, Gemma.
Nicola and her designated driver head home, well within the 4-hour target on casualty admissions.
What, you're going a bit dizzy on there?
She's now back in work after a full recovery. Being rushed in is 32-year-old Owen, whose car was hit by a 20-ton bin lorry, head-on.
Ready, steady, please.
We all complaining of C-spine tenderness and lower back pain. Yeah.
Over 900 people in South Yorkshire were seriously injured in car crashes last year. It's crucial the team get as much information as possible about what happened.
Hello, hi, my name's Dr. B and I'm one of the consultants. So, driving your car, lorries come in front of you, yeah, and hit your side of the car. Yeah, okay. Can you remember it all happening?
Yeah.
You weren't knocked out at all?
No, I don't think so, no. Basically, I was driving towards my place of work, and a bin lorry pulled across the front of me, in between two wagons, so I didn't see it coming. And basically, I've hit that wagon in my car head on.
If you're in a car and you're travelling at speed and the car does something fairly dramatic, then that would just make me think that they may have significant injuries. And it was your neck straight away?
Yeah, not long after, about a minute, if that.
Okay.
The top of the neck, just at the bottom of the skull.
Okay.
But my back's causing me a lot more pain now.
Okay.
At the very bottom. I mean, it's very, very painful now.
Right, so what I think we need to do now is get you off this board, but we're going to need to keep your neck still. Yeah, and then we'll just get you sent round for some neck x-rays and some back x-rays. If I hold, if I do neck.
I'm a cheeky.
Oh, sorry. You didn't tell me that.
I'm a surgery.
Oh, okay. Right. What have you just had done?
A lift on my cheekbone.
Oh, gosh.
It was fractured in 3 places.
Yeah, right. So if you help out by just keeping your head really, really still, then all right. I tell you what, your cheek looks pretty good, doesn't it? It's not that swollen, is it?
I just had the stitches out today.
Yeah. You're not having a great year then, are you?
No, it's not been going so well.
Yeah.
Ready? Which one taking out first? This one at this side, yeah? Yeah. Nice and steady.
He's had a fairly significant impact.
Yeah.
He's hit something that's considerably bigger than him, but the instant pain makes me worry a little bit more. So he's probably going to need undressing and see for his x-ray.
Dr. Bean has asked the nurses to give Owen some pain medication.
We're going to give you some of the good stuff.
Oh, God. I need it.
It's called Embark. It can make you feel a little bit drunk and a bit woozy.
Yeah.
To make you more comfortable while we're getting into that gown.
Yeah.
Right, Owen, pop this in your mouth.
Penthrox is a really useful drug, actually. It helps patients that have come in a lot of pain and discomfort.
Right, we'll get you round to the next row now. You look like a proper patient now.
Although in a positive way, it helps them, and they go a bit crazy on it.
Yeah.
Hey?
It's like whatever.
You're not punching. You're not doing this punching duty show, you know.
Yeah. Oh, no.
Their behaviour on it is a little bit funny sometimes.
How much do you sell these for? Oh my gosh. Ow. It's painful, but...
Okay. You're going to go and have a scan, and you're going to go and have an x-ray, and then hopefully, if those are okay, then we'll be able to take this contraption off from around your head, and then you'll be able to move. We'll be able to sit you up then.
Camille, sorry, I can't see you because
Go on.
I've heard somebody saying you feel real far away.
You do, yeah.
Can you come closer?
Well, what are you going to do?
No, nothing. I just need to hold somebody a second. Thank you. You've got a nice skin.
Oh, thanks.
Yeah, it is sometimes hard with what people come out with to remain a professional.
With Owen now a lot more comfortable,
Who are you?
he's taken to X-ray to discover the extent of any spinal injuries.
He's a porter, isn't he? He's a good lad. He's the backbone of the... If it weren't for him, people like me wouldn't be getting to where we need to. Do you want to go blast on that? Job blast on. Trust me, bro, you'll get to your next job quicker than you'll ever imagine. I'm telling you, honestly. She'll not tell on me. They'll not tell on me, will they?
What's going on?
I'm still in neck brace and stuff, so they're probably going to put a cannula in for the pain relief.
How are you feeling now?
Rubbish. Really painful. I've had some of this, but it's run out.
Am I able to come up or not?
Not yet, I don't think. I'm not like... I think I'm still in the A&E section, I don't know.
Yes, you are.
Yeah, I'm in A&E, yeah. Right, babe, I'm gonna go because nurses. Ah!
Oh, babe. That's not his neck, that's me pulling a piece of tape off it.
That was just tape. That was just tape.
Oh my god, do you think you broke your back?
Ah!
Stop making him laugh now.
No. Right, I'm gonna go. I gotta go. Love you.
Come on, broke your back.
You better wheel me about. I love you.
Love you, bye.
Bye.
Owen's case has been taken over by consultant Dr. John Rayner, who's been assessing his x-rays and is ready to deliver his findings.
Hello there. Is it Owen?
Yeah.
My name's John, hello.
Hi.
One of the doctors working here today.
Hello.
X-rays look okay.
Oh, good.
Owen's x-rays reveal no fractures or other injuries from his car crash. It's safe to remove his neck brace.
So what I'm not going to sit you up right away, okay? I don't think
Yeah.
that'll be very fair. You seem to be very sore.
Yeah.
I'm going to take the side bits off.
Okay.
And then we'll get you some tablets to take for the pain.
Right, okay,
Get you some codeine and some paracetamol if you've not had any this morning.
Right.
And then we'll see what you're like after a bit of rest. In a better position than you're in, okay? So I'm going to ease the collar up ever so slightly again, all right?
Okay, yeah.
But you don't need to move. I'm just going to move the trolley a little bit, all right? Just going to be a couple of degrees, okay? How's that?
Yeah.
Not bad?
Yeah.
We'll get you some tablets to take, all right? And then when they start to kick in, we'll come and move you a little bit more, okay? All right.
Right, your collar's off, so I'm going to put this on your face, all right?
Yes.
Okay. There you go.
Can't see me laughing, mate.
Eh?
Can't see me laughing.
Eh? Can't see me scowling either.
Yeah, I'm a bit sat up now. They're gonna try and stand me up, make sure that I can weight bear properly with my back.
Right, so that broke or anything?
No, nothing showing up in X-rays and that. So, you've been crying, you?
No?
Good.
Stressed.
Why?
Oh, because I didn't know what was going to happen. No, I didn't know what was happening.
Right, I'll give you a bell in a bit. Alright.
Okay.
I'll keep you informed.
Okay, love you, bye.
Right, love you. Love you, bye.